So a total hip replacement is whenever we remove the ball, we clean out the socket of the hip joint, and we're putting in metal and plastic in order to make up for that lost bone, lost cartilage. We actually remove a little bit more bone than we would for a knee because the forces that go through the hip are a little bit different. So we need to spread those forces out into the thigh bone. That's one of the ways we make sure that these are going to stay stable and last a long time. So total hip replacements are interesting in that most patients will come in not even realizing that it's coming from the hip joint. Hip pain most of the time, not all the time, actually happens in the groin. So for folks who come in with really bad groin pain that's not responding to other treatment options, that's whenever we consider a total hip. And it's a wider range age of patients that'll come in because there's a lot of different reasons we'll do a total hip, and it can get kind of complicated. But depending on what the disease process is going on in the hip joint, making sure that we've tried the easy things, make sure it's not going to get better, making sure that a smaller surgery may not solve the problem, that's when a total hip replacement's a great option. Getting a hip replacement, just as any other replacement or surgery, biggest concern is going to be infection. Managing risk factors, making sure we reduce that risk is going to be key. Fortunately for us, our risk in our patients who get a number of infections is much, much lower than the average, but still something I always worry about. Whenever we do a replacement, we worry about trying to get your leg length as close to even as possible. Sometimes we have to actually adjust it longer or shorter based on the soft tissue, the nerve, trying to make sure we have good stability. So that is a risk, is that it's not going to be exactly the same as the other side. We worry about fractures around the implants, especially if you were to have a fall, and that's a big one, so using the walking aids to be careful about that. We worry about the nerves around the hip joint. We do some things and we monitor some things to make sure we're protecting that nerve. And then lastly, all the things with any anesthesia procedure, we worry about blood clots, heart, lungs, making sure we're safe and healthy for surgery, and that's something we're certainly going to discuss before we ever go to the operating room. So whenever we do a hip replacement, you're going to be up and walking the same day. The goal is to get out of bed, start moving right away. In select patients, we actually do these outpatient now, where we can do surgery, we can go home, you can be with your family, your loved ones, you can rehab at home. Home health will typically come to you. Hip replacements, if you look at it on average, tend to get functional recovery a little bit faster than a knee replacement. So folks are moving up a little bit quicker. The slower portion is learning how to balance around a hip replacement. A lot of folks going into a hip replacement have really bad weakness in the muscles around the hip joint because it's had problems for a while, so folks have compensated. The walking aids, usually you're using them for some folks as little as 1 to 2 weeks, some folks need them as long as 4 weeks. But really it's not because you're leaning on that. It's mostly to kind of help get rid of a limp that you have had for a long time. But again, with the newer approaches to hip replacements that we're using, and there's a lot of different approaches. Don't fall for the advertising where somebody says, oh my goodness, my way is the only way to do it. They all still have risks, they all still have recovery windows. So you want to make sure you have a real comfortable relationship with your surgeon, so that way you have a good expectation with what you're going to see. But I'd say in general, you're going to see a lot of improvement right away, getting a lot stronger, getting rid of that limp for 4 to 6 weeks on average. 3 months is whenever we consider it completely healed, and you're going to be adding new activities, things you haven't been doing. And then full recovery, we say you keep on getting better for a full year, but you're doing a lot way before that. The total hip replacements are one of the most successful surgeries in all of medicine if you look at overall satisfaction rates. So whenever you get a total hip replacement, folks do extraordinarily well on average. The downside is if you do have a complication, it does end up being one that really can limit you. So if you talk to folks and you find somebody who's had a problem, they're certainly going to be vocal about it. And again, that's something that's valid. So you've got to make sure you really know what you're getting into. That being said, it's such a great surgery and folks do overwhelmingly well. They're moving again. You don't have very many restrictions. The biggest thing, as with all of these surgeries that we do, we worry about falls, we worry about trauma. But in terms of activity level, you're doing so much more than you were before surgery. And the recovery is relatively quick as long as you can put in the time and effort and you work with the therapist to make sure we get strong. So it's a great surgery. I think the biggest misconception is, a stigma around having a replacement. But I really recommend people, if you are in a position where you're having this pain, you have these limitations, please consider it.